Welcome to Supplements Demystified. In today's video we will be talking about cinnamon. We are going to cover why cinnamon is a superfood, its medicinal properties and how to supplement it effectively. Cinnamon has been used for ages as a spice and in natural medicine. A number of studies show it has anti-inflammatory, antibacterial and antioxidant properties. In addition, it also shows promise against neurological disorders, such as Parkinson's and Alzheimer's. There are two main types of cinnamon, cassia and Ceylon. The Ceylon variety is milder than cassia and has a more subtle and complex flavor, but they both contain beneficial phytochemicals. Cinnamon has been proven to be a powerful antioxidant and free radical scavenger. The phenolic acids and polyphenols in cinnamon have been shown to reduce oxidation of lipids in the body, and increase overall antioxidant capacity. A study published in the Journal of the American College of Nutrition looked at the effects of cinnamon extract on the antioxidant status of diabetic overweight adults. The study included 22 people with impaired fasting blood glucose and a BMI of 25 to 45. The subjects were given 2 capsules containing either a placebo or 250 milligrams of a cinnamon extract for 12 weeks. Patients who took the cinnamon extract had lower oxidative stress markers, more antioxidants in their bodies, and lower fasting blood sugar levels at the end of the trial. Cinnamon has been shown in several studies to control inflammation via a variety of enzymatic and cellular pathways. Researchers discovered that cinnamic aldehyde significantly reduced the production of inflammatory mediators such as nitric oxide, tumor necrosis factor and prostaglandin in both cell culture and animal experiments. It also inhibited the expression of other enzymes and proteins involved in the immune and inflammatory response. In testing, cinnamic aldehyde also increased the activities of antioxidant enzymes like catalase, superoxide dismutase and glutathione peroxidase, all the while decreasing levels of oxidative stress markers. In animal studies, cinnamon was able to reduce swelling and inflammation to the same extent as nonsteroidal anti-inflammatory drugs. Cinnamon is able to help with blood sugar control in both healthy and insulin-resistant adults. Research has shown there are several mechanisms via which it is able to prevent spikes in blood glucose and potentiate the effects of insulin. The effect of cinnamon tea on postprandial glucose levels in healthy people was investigated in a study published in the Journal of Diabetes Research. 30 non-diabetic adults aged 20 to 53 were recruited for the study and given an oral glucose tolerance test before receiving cinnamon tea or a placebo. Glucose levels after the test were significantly lower in the cinnamon tea group than in the placebo group. A study from the United Kingdom attempted to determine the effect of cinnamon on HbA1c, blood pressure and lipid profiles in people with type 2 diabetes. The study enrolled 58 type 2 diabetic patients, with an average age of 55, and gave them either 2 grams of cinnamon or a placebo every day for 12 weeks. At the end of the study, the cinnamon group had a lower HbA1c by 8%, and their blood pressures dropped by 3 to 5 points. Fasting blood glucose, waist circumference and body mass index all decreased significantly. According to the researchers, while 2 grams of cinnamon is an effective dose, higher doses will have a stronger effect. Cinnamon extracts and oils have been shown to have potent antibacterial and antifungal properties. Multiple studies have shown that it is effective against gram-positive and gram-negative bacteria, as well as fungus and yeast that cause human infections. In a study published in the Journal of Agricultural and Food Chemistry, cinnamon stick extract was evaluated against 5 common foodborne pathogenic bacteria: Bacillus cereus, Listeria, Staph, E. coli and Salmonella. Cinnamon's major components, cinnamaldehyde and proanthocyanidins, proved to have significant antibacterial properties. While there are many possible explanations for cinnamon's ability to kill germs, the researchers propose it's because it destroys the bacterial cell wall and cytoplasmic membrane, while leaving healthy cells unharmed. Cinnamon has been shown to have anti-tumor activity in a variety of cancers, including breast, leukemia, ovarian and lung tumor cells. 2 of cinnamon's main phytonutrients, eugenol and cinnamaldehyde, have been extensively researched for their anti-cancer potential. Controlling the expression of growth factors is one of the most important goals in cancer treatment. Researchers found cinnamon inhibited growth factors in melanoma cell lines in a dose-dependent manner, and according to the findings, while cinnamon inhibits cancer cell proliferation, healthy cells were unaffected. Cinnamon essential oil has been shown to reduce epidermal growth factor in laryngeal squamous cell carcinoma. In animal trials, mice treated with cinnamon oil experienced a 43.5% reduction in tumors. In addition to its anti-proliferative properties, cinnamon appears to target a variety of mechanisms that contribute to cancer cell death. Mice with melanoma who were given cinnamon extract either orally or via injection showed a significant reduction in cancer progression in just 22 days. Eugenol and cinnamaldehyde have both been shown to induce apoptosis in cancer cells through mechanisms like DNA fragmentation, increased oxidative stress and proteolytic cleavage. Some studies even show eugenol has chemosensitizing effects when combined with conventional chemotherapeutic drugs, like gemcitabine. Cinnamon consumption has been associated with lower cholesterol levels in multiple studies, with longer duration treatments offering greater benefit, particularly in diabetics and those at risk. A study published in the Journal of Diabetes Care looked at the effect of cinnamon on blood glucose and lipid levels in adults with type 2 diabetes. The trial enrolled 60 type 2 diabetes patients who were already receiving treatment with sulfonylurea medications. Participants were split into 6 groups and given 1 to 6 grams of cinnamon per day for 40 days. At the end of the study, all cinnamon groups had lower fasting serum glucose, triglyceride, LDL and total cholesterol levels. Researchers discovered that people who consumed any amount of cinnamon had lower glucose and cholesterol levels even after stopping for 20 days. While the exact processes by which cinnamon decreases blood pressure are unclear, human and animal studies suggest that it can help dilate and relax blood vessels via several mechanisms related to vasodilation. A meta-analysis was published in the Journal of Clinical Nutrition, which looked at the effect of cinnamon supplementation on blood pressure in adults. The data was compiled from 9 randomized control trials involving a total of 641 participants. The study selection criteria were fairly broad, including trials ranging in duration from 8 to 18 weeks and participants in various stages of insulin resistance and hypertension. The data showed that blood pressure reliably dropped by 3 to 5 points on average. It was determined the effective dose of cinnamon was at least 2 grams per day, and the treatment should last at least 8 weeks. Cinnamon has been shown in several studies to help protect neurons in models of Parkinson's disease. It protects cells from oxidative stress, reduces the production of reactive oxygen species and corrects autophagy dysregulation in the brain. Studies have also revealed that it has antioxidant properties and upregulates beneficial proteins, while also modulating inflammatory pathways. The clumping of alpha-synuclein proteins in Lewy bodies and dendrites is a critical step in the progression of Parkinson's disease. Cinnamon has been shown to inhibit alpha-synuclein protein aggregation, reducing the formation of clumps of abnormal protein particles in the brain. In Parkinson's disease animal models, cinnamon was able to improve motor function and restore neurotransmitter levels. Cinnamon or its metabolites have not been studied in human clinical trials for Parkinson's disease. However, the metabolite sodium benzoate has been studied in people with Alzheimer's and schizophrenia, and it has been shown to be well tolerated and to improve cognitive and overall function. In Alzheimer's disease models, cinnamon has been able to protect neurons and stop the process of neurodegeneration. According to research, it can help prevent the buildup of amyloid beta peptides and tau proteins in the brain, as well as provide strong antioxidant and anti-inflammatory support. In a 2011 study from Tel Aviv University, scientists found that cinnamon stopped amyloid beta plaques from forming and causing harm in both isolated neuronal cells as well as in animals. When mice that had been genetically engineered to have Alzheimer's disease were treated with cinnamon, and then put through cognitive tests, they did just as well as healthy mice. According to research from the University of California, Santa Barbara, Ceylon cinnamon can inhibit tau aggregation and filament formation, both of which are hallmarks of Alzheimer's disease. Cinnamon extract was found to be capable of degrading tau filaments taken from diseased brain tissue, while at the same time not interfering with tau's normal function. Now let's talk about how to take cinnamon both safely and effectively. Most studies use 1 to 6 grams of cinnamon per day, with 2 to 3 grams being an effective and well-tolerated dose. Because of its low coumarin content, Ceylon cinnamon is safe to consume on a regular basis. A teaspoon of cassia cinnamon powder contains 6 to 12 milligrams of coumarin, which can quickly become toxic in people with lower body weight. Cinnamon powder can easily be added to smoothies, drinks, and foods like oatmeal. In general, 1 teaspoon of cinnamon is equivalent to 2.76 grams. Another option to supplement cinnamon is using standardized extracts. Both cincillin and cinnalin PF have been used in studies with proven efficacy. Those suffering from irritable bowel disease should be careful with the consumption of cinnamon as it may cause a flare-up of symptoms. While cinnamon in modest doses can help to settle an upset stomach, in large doses it can cause nausea and vomiting. Anecdotal reports claim cinnamon causes an increase in body temperature and sometimes sweating. As always, start with a low dose to see how your body reacts. If you have any questions, leave them in the comments below and remember to like and subscribe for more content. As always, Thank you for watching, and see you next time.